Thank you so much for the invitation to participate in this policy forum. I've been asked to set out some ideas and some history, some background of the policy context in Canada and explain, I guess, some key coordination problems that we have faced over the years and put forward some highlights for policy options. What can we actually do to improve coordination in Canada? So, there's a lot of work that's been taking place in the country over the past, I would say, 30 years or so. But the real starting point for disability policy typically is seen to be 1981. It was the International Year for Disabled Persons. The first Prime Minister Trudeau appointed an all-party House of Commons committee to look at what was happening in Canada. And there wasn't very much, actually, in a very systematic way taking place in the country. I had the honor of working for that parliamentary committee. It was fantastic because there were people who actually from different parties got along so well, and they were all on the same page. They put forward 130 recommendations for change in the obstacles report. Perhaps the most important recommendation was the inclusion of physical and mental disability as a proscribed ground of discrimination in our Charter of Rights and Freedoms, which took effect the following year as part of the Constitution Act introduced in 1982. Canada was the first country in the world to introduce that protection, and we should be really proud of it. I think that I guess easily could say that we spent the next perhaps 20 years trying to then figure out exactly what that meant and giving life to that, those charter rights, because it was so important. And the notion of equality rights, of citizenship, of inclusion, of engagement, of full participation, of mainstreaming, all those themes were echoed throughout the years following the obstacles report and the work of that parliamentary committee. I've listed here just a few of the initiatives that took place in the country. Emile presented a whole list of initiatives yesterday, and I guess I'm adding to this list because I have to say there was no shortage of conversation in those years following 1981 about how can we work together. That was important, together on disability-related policy. So, for example, National Strategy on the integration of persons with disabilities, that was really a coordination approach at the federal level. There were 12 federal departments working together over 5 years to try to ensure that their policies were coordinated. Then there were federal and provincial initiatives that took place as well. Perhaps the most important of this list is the In Unison working group, the federal provincial working group that's listed here, that produced the In Unison report. And I'll come back to it later, but I mention it because they set out a very clear conceptualization of how they understood citizenship. And full citizenship, in their view, was the result of good working systems with respect to employment, disability supports, and income security. And each of those areas had to work very well together, and they all had to be integrated. So they had to be a system in and of themselves that was working coherently and working well, and then they had to coordinate and be intrinsically linked in order to ensure full citizenship. So there were many fantastic reviews that were, that had taken place, but I mentioned that one because I think it's relevant to the work here and maybe worth going back to. Then we had the next, I guess I would say in the policy world, from 2006 to 2015, the Harper government that was interested very much in employability and initiated many different kinds of programs and supports to ensure both job creation and the employability of people with disabilities. And so we saw a focus on, we did have the ratification, by the way, in the UN Declaration of Rights of Persons with Disabilities, but the main focus was on labor market agreement, development agreements for people with disabilities, post-secondary educational grants, opportunities fund, the enabling accessibility fund, and then there were several income security programs. I think that period saw a number of important achievements, but it was marked primarily by initiatives that the federal government undertook either on its own, for example, the Registered Disability Savings Plan, or bilateral agreements between the federal government and individual individual jurisdictions around, for example, the labor market development agreements. So now we're in a bit of a different policy context, which is the current government. We're not sure exactly what the agenda might be. We have a new federal minister of disability, and in the past, ministers of state responsible for disability had the responsibility for ensuring coordination among all the different federal departments. So that may well be a role of the new minister. There were few references in the Liberal platform to disability, but we know that the mandate letter for the Minister of Children, Families and Social Development calls for a new Disabilities Act in the country. So, it's perhaps an open book. There certainly is, I think, an invitation for collaboration and for coordination. So this is a fantastic time for us to be having this conversation, both about the substance and about the process. I would like to get back just briefly to the building blocks to which the In Unison report referred from that Federal-Provincial working group. Again, I had the honor of working with that Federal-Provincial group, and several of you were actually working on that initiative at the time. And I think that conceptualization is important because I will be discussing that. Income security, disability supports, and I mean by that technical aids and equipment and a range of services that enable independent living, and then labor market programs. And when I think about coordination, it's not just about navigability and ensuring that people can access what's there. It goes beyond. So I'm going to talk very briefly about coordination within policy domains, between policy domains, within jurisdictions, and then between jurisdictions, because I think we can look at coordination quite broadly and have a number of interpretations. So I just very briefly want to touch on some of the problems, and you probably know all of this already, so just let me touch on this really, really briefly. Income security, we don't have a system in the country. We have a set of disparate programs, each of which has its own eligibility criteria, each of which is administered differently, and each of which pays a different benefit. And you may have very much the same functional ability as somebody else in the country, but receive a very different amount of income support, and your security associated with your program might be very different from someone else. So we have a number of serious problems in income security, well documented, I think, by many people in this room, and John's going to be speaking about income security as well in a minute. Disability supports is another area where it's a really complex mess. I would say there's no real system. I mean, every jurisdiction provides their supports differently, and that's Canada. So yes, that's fine that we do that. But at the same time, even within jurisdictions, you have different programs being provided in different ways. So if you're with workers' compensation, you may get one set of programs. If you're in post-secondary education, you have access to something else. If you're in the health system, you have access to a whole different set of services. If you're on social assistance, you may get access to certain disability supports. And I say may in all cases because nothing is guaranteed in this system. It's the result of what you have, where you live, and if there's enough money remaining in the budget at the end of the year. So there's a lot of work to be done to fix that, and I'll talk about that in a minute. And labor market programs, I mean, similarly, many people in the room have documented the coordination problems that we have. We tend to have individual programs set up for specific disability-related groups. They're not coordinated between themselves, and they're not coordinated with disability supports and the income program. So we have all these disparate pieces happening, which make it a very, very complex and really difficult system to navigate, and certainly in need of improvement. So again, I'm just going to be talking about coordination briefly within policy domains, between jurisdictions, and among policy domains. Let me just say, I'll give an example of how we can look within a policy domain. And I provide the example of disability supports, but I just want to say work has been done within the income security system as well. There was an exercise, for example, in Quebec, where they were looking at their income security programs and saying, how can we have a more coherent system? This is not good enough. Now, they could do that more easily than the rest of the country because they were in control of all their own programs. So that was an easier thing. In terms of looking at coordination within systems, we've written a report called 5-Point Plan for Reforming Disability Supports. It has to do with ease of navigability, coordination that you referred to, Ron, in terms of somebody actually helping you. Those are, I think, coordination issues that should be addressed and carried out. If we do nothing else, we can do that. That is the least that we should be doing with respect to coordination. There's no reason why we can't improve our coordination system within policy domains. A second example has to do with coordination between policy domains. And here what I'm talking about is a far bigger reform. And we need to talk about this, I think, more carefully. This is a bigger coordination issue. It has to do with removing people with severe disabilities from welfare, because we have more than 500,000 Canadians on welfare with severe disabilities. That makes no sense. Welfare is an income program of last resort. We have proposed at Caledon taking people off welfare who have a severe disability. You have a federally delivered program like a guaranteed income supplement program, which is adequate, which is portable, which is indexed to inflation. It goes up if you have less income, it goes down if you have more income, you can work, you don't have to work. It's adjusted according to your needs. And the provinces and territories that would then have a windfall gain would be required under a negotiated agreement to reinvest in disability supports. And there's precedent, there's policy precedent for this. We worked on this with the National Child Benefit, where the federal government picked up children's benefits on behalf of those families on welfare, and now all low-income households have access to children's benefits, and provinces reinvested in services. It's almost like a better coordination through a, almost taking it apart, taking the roles out, separating them out, and ensuring that the level of government responsible really does the best that they can do. I'll just talk very briefly, improving coordination between jurisdictions. We can look at joint funding arrangements. We have that around the labour market agreements. I would like to see that around the development of a disability supports fund. And I say that explicitly a fund rather than going through a general transfer, because funds through transfers like a Canada Health transfer or social transfer easily can get lost. My economist friends call this fungibility. I'm not sure what, John, you probably know what it means. It means it can get lost in roads, sewers, and anything else. We don't want that. We want joint sharing of funds and moving in the same direction. Another example of coordination. I'll just very briefly say the Federal-Provincial Working Group put forward In Unison. It had a very good conceptualization of what coordination meant among those three systems. So I won't go into that now, but only to say maybe it's something that we should go back to, because it is still quoted today by provinces and territories that look to it as a model. And finally, another way to improve coordination is through individualized funding, where you're actually giving money to people, and the supports and services, whatever they might be, whatever they might need, are following them in any place they require. That's coordination almost through the demand side of the equation, through the individual. The one challenge is that individuals would still have to negotiate a very complex system. And so even if we're going to do individualized funding, we need to work on some of the other areas that we've identified and through some of these other approaches. And I think now is a fantastic time. So I'm really excited. And thank you so much.